If you ever wanted to do something about your hair loss condition, but were unsure how to proceed, here's how you can help play a role in diagnosis and treatment. Let's get started. Whether you were losing your hair prior to the shutdown or noticed you've been shedding more hair lately, you might wonder if there's anything you can do while stuck at home. You actually can do something. You can obtain a remote diagnosis of your hair loss condition and get advice on how to treat it. The average person is born with about 100,000 strands of hair, and we naturally shed around 100 hairs per day, which mostly goes unnoticed. To identify if you are experiencing accelerated hair loss, here are two things to keep in mind. First, if hair loss runs on either side of your parents' family, then you might have inherited the genes responsible for hair loss. Second, if you see clumps of hair on your pillow or in the shower, you are probably experiencing accelerated hair loss and should seek professional help. The main reason for hair loss in both men and women is related to genetics. In men, genetics account for about 90% of hair loss. The other 10% is linked to underlying metabolic condition related to hormonal imbalance, nutritional deficiency, and abrupt change in lifestyle or medications. In women, 50% of hair loss is due to genetics, and the other 50% caused by an underlying metabolic condition. To get a diagnosis for your hair loss condition, take various photos of your hair and scalp using a regular or cell phone camera. Set the zoom level to maximum magnification when taking shots of your scalp. Contact a board-certified hair loss specialist and send them your photos along with the family history of hair loss, medications, and recent changes in your diet and lifestyle. Depending upon the professional, they may have the capability of analyzing your photos with a system that measures hair diameters and calculates overall hair density. If the analysis shows great variance in hair diameters, but hair density is close to normal, the hair loss is probably due to genetics. However, if the hair diameters are uniform, but the overall density is lower than normal, the hair loss is most likely due to an underlying metabolic condition. For genetic hair loss, finasteride and minoxidil are the only two medicines approved by the FDA. These go-to medicines have been around many years and work very well. In the past few years, we've seen exciting new regenerative cellular treatments which augment the two FDA-approved medicines. In combination, they work together to stop hair loss in its tracks and reverse the hair miniaturization process so small and weak hair return to full health. For metabolic hair loss, after treating the underlying condition, in most cases, the hair will grow back with no further intervention. Many of my clients contacted me during the shutdown saying they were losing their hair. After reviewing their photos and answering various questions, I was able to provide treatment options for them to pursue. So even though you are stuck at home, I hope this video empowers you to take charge of your situation and seek a professional diagnosis from a board-certified hair loss doctor. If you have questions regarding this video or questions about hair loss in general, please leave them in the comments. Also, please click the subscribe button and hit the bell to stay up to date on other hair care ideas during this most stressful and challenging time. Thanks for watching.